let me introduce you to this Republican representative. This is Mariannette Jane Miller-Meeks. She is a 70-year-old Republican representative from Iowa. She is also a physician, and she said this.
Whereas if you had a health savings account or individual health plan, you purchase your insurance for catastrophic, then there is an incentive for you to adopt behavioral patterns or health practices that actually lower cost and keep you healthier. So you need to have a system that does both, takes care of you when you're ill and you're sick, but also incentivizes you to adopt healthy behaviors that keep you healthier and keep you out of the hospital. When there is a copay and a deductible, there's some skin in the game. Patients don't overutilize, and they're more likely to adopt healthy behaviors, whether it's decreased smoking, whether it's more exercise. You don't have to go do aerobic exercises or hot yoga. You just need some level of exercise so that how many calories you're expending is more or equal to what your input is, what type of foods you eat.
Now, obviously, she is correct when it comes to how one burns calories, consumes calories, and burns calories. But when it comes to the healthcare debate, what her argument is that the more you have to pay for your healthcare, the more you have to pay in the form of your health deductible, your co-payments, your premiums, whatever the case may be, the more money you have to put out, the healthier the decisions are going to be that you make. It's going to force you to make healthy decisions so that you stay out of the doctor. The problem with that thought process is as follows. That's not what the data shows. Here in the United States of America, we pay by far the most for our health care. We have the most skin in the game. Yet, we don't make those healthy decisions. We don't have a society that makes healthy choices. I am a living example of that. However, in almost every other industrialized nation where there's universal health care, they do have better health outcomes. Why? Those people have less skin in the game. Because when you have a system that uses tax dollars for the people, rather than for whatever the hell pet projects they want to use it for. When you utilize the people's tax dollars, when the government has skin in the game in the form of tax dollars, what they do is they set up a healthcare system that encourages and promotes proactive healthcare rather than reactive healthcare. There isn't a huge profit margin to be had. People aren't making billions of dollars off of your ailment. Here in the United States of America, we have a proactive healthcare system. Do what you want. Smoke that, eat that, drink that, go lay by the pool. We've got a procedure if you get sick. We've got a pill if you have an illness. It's a proactive approach to healthcare, and we have the most skin in the game. Yet everywhere else, it's a reactive approach, I should say, and everywhere else, it's a proactive approach. Everywhere else, they're teaching their citizens to live healthier on the front end so that they're utilizing services less on the back end, and they're doing it through a universal healthcare system. So, it's nice to say things that may sound like they make sense, but when you look at the actual data, that's not what the numbers bear out. So saying to people, we have to pass legislation, for example, that makes your health care more expensive so that you have more skin in the game, so that you make healthier decisions, that's not borne out by the reality on the ground. All that's happening is you're just making us pay more for our health care. Again. And if I could, I'd like to put a little PS on this particular video. This is what I'm talking about when it comes to people that are part of the baby boomer generation and the silent generation who should not be allowed to be in government. I don't even think people from my generation, Gen X, should be allowed to hold many seats in government. And here's the reason why. This woman is 70 years old, and she is spouting factually incorrect information that is and voting in a manner that is causing American citizens to have to pay more for their health insurance. But she herself is never going to have to live with the consequences of her vote. First of all, she gets her health care from us. We pay for it. Secondly, she's 70 years old. She's not going to live long enough to see the long-term ramifications of her votes. It is insane to me that we are allowing 70 and 80-year-olds, hell, in some cases 60-year-olds, but 70 and 80-year-olds to make laws that are going to govern our society for the next 30, 40, 50 years, and they aren't going to be around for a fifth of that. They are affecting generations of Americans adversely, and they will feel none of the effects. That's a problem.